There are calls for hospitals to start using vitamin D immediately to treat COVID-19 patients, after a study claimed it reduces deaths from the virus by 60%. Former Brexit Secretary, MP David Davis, said the findings, published by the Social Science Research Network, are part of a very important study. The research looked at the effectiveness of using calcifediol, a vitamin D3, when treating more than 550 people on coronavirus wards of the Hospital del Mar in Barcelona, Spain. Those who took part in the trial were randomly assigned as either recipients of the calcifediol treatment or as controls. The patients received 5 doses of the vitamin in increasing intervals of 2, 4, 8 and 15. Have you had your vaccine yet? Let us know in the comments below. David Davis said, on Twitter, the findings of this large and well-conducted study should result in this therapy being administered to every COVID patient in every hospital in the temperate. Furthermore, since the study demonstrates that the clear relationship between vitamin D and COVID mortality is causal, the UK government should increase the dose and availability of free vitamin D to all the vulnerable groups. These approaches will save many thousands of lives. They are overdue and should be started immediately. The study found COVID-19 patients given the vitamin D doses were 80% less likely to need intensive. The University of Barcelona also concluded that adjusted results showed a reduced mortality of more than 60% for people who received the treatment, the Mail Online. The research is preliminary and still awaiting peer review. However, the results showed 36 of the 551 patients treated with calcifediol died from COVID-19, compared to 57 patients out of 379 in the researchers found only 5% of the calcifediol group were admitted to the critical care unit. The study said, in this open randomized study conducted during the first European outbreak of the deadly COVID-19 pandemic, we have observed that, in hospitalized COVID-19 patients, treatment with calcifediol reduced the requirement for critical care by more than. This supports the conclusion of a prior pilot trial in Cordoba in which calcifediol treatment led to a reduction of more than 50% of ICU admission in hospitalized COVID-19. Health Secretary Matt Hancock previously said the link between vitamin D and the COVID was being kept under review as studies began to demonstrate those with low levels have a higher